Hello, and welcome back to Health Bulletin. We're here to bring you the medical updates of this week. This week has been bustling with breakthroughs and developments in the medical field, where we dive into the latest advancements, groundbreaking research, and innovative health solutions that are shaping our world. From novel treatments to public health trends, stay tuned as we uncover the most significant medical news that you absolutely need to know. Cameroon launches malaria vaccination program. The global fight against malaria took a stride forward on Monday as Cameroon launched the world's first routine vaccine program against the mosquito-borne disease that is projected to save tens of thousands of children's lives per year across Africa. Around 40 years in the making, the World Health Organization approved RTSS vaccine, which is developed by British drug maker GSK. Vaccine is meant to work alongside existing tools, such as bed nets to combat malaria, which in Africa kills nearly 500,000 children under the age of 5 each year. After successful trials, including in Ghana and Kenya, Cameroon is the first country to administer doses through a routine immunization program that 19 other countries aim to roll out this year. A new research from World of Autism study conducted on mice shows how male and female brains may be equally prone to autism, adding to evidence suggesting the condition has been significantly underestimated in women. Studies of ASD, led by neuroscientist Manish Kumar Tripathi of the Hebrew University of Jerusalem. Research has been published in scientific reports. Historically, autism has been thought of, studied as, treated and diagnosed as a primarily male disorder. Since the diagnostic criteria are male-centric, more boys are referred for diagnosis and then diagnosed, at a rate of around 4 boys to every girl, as they found that female brains are not more resistant to autism after all. They suggest that, in addition to presenting differently, girls are more likely to camouflage their autistic traits than boys, and that this has been deeply under-recognized and understudied, urging the scientific community to broaden its approach and include females in ASD studies. Now, with recent surge in measles, UK health officials on Monday urged millions of parents to book their children for missed MMR shots, as UK witnessing a sharp increase in the number of measles cases and the lowest vaccination rates in a decade. Vaccination rates have dropped to about 85% nationally. That is too low to maintain safe population coverage. It should be at about 95%, as advised by the World Health Organization, WHO and the US CDC said in November that measles deaths globally spiked by more than 40% last year, and cases rose after vaccination levels dramatically dropped during the COVID-19 pandemic. Measles infection can lead to permanent physical damage such as deafness. Most deaths are due to complications like encephalitis, severe dehydration, serious breathing problems, and pneumonia. It believed more recently, declines in vaccination uptake were exacerbated partly by the pandemic and anti-vaccine sentiment. Now, a new breakthrough research shows that a simple blood test can flag symptoms of Alzheimer's disease up to 15 years in advance. Scientists from Sweden's University of Gothenburg have found ways to simply test for the residue of a protein known as phosphorylated tau-217, p-tau-217, which is commonly associated with the disease known as phosphorylated tau-217, p-tau-217, with impressive results. Testing procedure offers a comparatively painless, less expensive than to spinal taps. The test can help healthcare providers determine the presence of amyloid plaques in the brain early, a hallmark of Alzheimer's disease. Now think about the spiciest dish you've ever put in your mouth. Now think about the taste. Hard to describe, right? But even if you like spice, you probably thought it was uncomfortable. And that's because when we eat ultra-spicy foods, it actually causes a painful sensation in the mouth. It's not sweet, salty, bitter, sour, or umami, the 5 main tastes our tongues can detect. But pain, in the case of spicy food, a little bit of pain might be kind of, well, good. In fact, it may induce endorphins for some people, but not necessarily everyone, which explains why many do not enjoy eating spicy foods, but plenty of others do. Spicy food also may come with some health benefits, which makes that weirdly pleasurable yet painful sensation even more worth it. Spicy food is associated with some health benefits, and that might be down to a chemical called capsaicin. This is basically the active component of chili peppers, responsible for bringing the heat. When our mouths detect capsaicin, It kickstarts the fight or flight process, and the body releases stress hormones like adrenaline. As your body responds to the sensation of heat, you start to sweat, you turn red, your heart rate increases and your nose runs. You know the drill. And for some people, the body also releases endorphins, just like when you exercise, which produces a natural high. In 2020, one study from the American Heart Association linked consumption of chili peppers with a potentially lower risk of death from heart disease and cancer. Canada Research is leveraging deep learning technology to democratize access to personalized cancer vaccines for all individuals. Deep learning technology is making immunotherapy treatment more accurate and affordable. Cancer is the leading cause of death worldwide. Traditional cancer treatment has consisted of 3 pillars: surgery, chemotherapy, and radiation. In the last 30 years, researchers have been developing a 4th pillar of cancer treatment, immunotherapy, which is essentially using own immune system to fight the cancer. According to the latest news on infectious disease outbreaks, authorities in Kazo district have confirmed an outbreak of anthrax in Marama, Uganda. This has raised concerns, particularly among those reliant on selling animals and animal products for their livelihoods. For nearly a month, the district has grappled with a rare outbreak of anthrax. This outbreak has claimed at least 6 lives and led to several hospitalizations. Anthrax is a zoonotic caused by Bacillus anthracis, a spore-like bacteria that produces strong toxins that are dangerous to animals and humans. Ruminants such as cows, goats, and sheep can quickly die with their carcasses showing little signs of infection. But in human beings, symptoms begin with a flu-like illness, raised boil-like lesions on the skin. Zambia is reeling from a major cholera outbreak that has killed more than 400 people and infected more than 10,000, leading authorities to order schools across the country to remain shut. A large soccer stadium in the capital city has been converted into a treatment facility. The outbreak in Zambia began in October, and 412 people have died and 413 cases have been recorded. As per the Zambia Public Health Authority, the United Nations Children's Fund, UNICEF, called the fatality rate of around 4%. In the 3-month outbreak, that's a devastatingly high number. Zambia had received around 1.4 million doses of the oral cholera vaccine from the WHO and expected more than 200,000 more to arrive soon. Zambian government officials, including Masibo, took a vaccine publicly to encourage others to also do so. Thank you for joining us. Stay tuned for even more medical news in the weeks to come. Don't forget to subscribe to our channel for the latest health updates.